All right, so hi everyone. Thank you for joining us today for our Introduction to Agile webinar with the Leading Edge group. My name is Marissa Lestry and I'm a Policy and Program Officer with the Ontario Public Health Association. So just before we jump in, I just want to do a land acknowledgement. So I am working in Toronto and would like to acknowledge that this is the land of the Anishinaabe, the Haudenosaunee, the Wendat, and the Mississaugas of the New Credit First Nation. We recognize that Indigenous practices of health and well-being have been in place on this territory for thousands of years and are maintained to this day. And I myself, as a settler, am very grateful to have the opportunity to work on this land. So for those of you joining us on the line that might be new to the Ontario Public Health Association, I just want to share a brief mention about who we are. So we are a member-driven, nonpartisan charitable organization and focus on providing leadership around issues affecting the public's health and strengthening the impact of those who are active in public and community health throughout Ontario. And if you want to stay up to date with some of our work, please sign up for our e-bulletin on our website. So just a few housekeeping items. So you will notice that there are two buttons on the bottom of your screen. One is the chat function and the other is the Q&A function. If you do have a question for any of our speakers, we ask that you please submit that through the Q&A function. And if you want to chat amongst yourselves, the participants in the group, please use the chat function. So I'm now pleased to introduce John Walton of the Leading Edge Group to introduce today's webinar speakers.
Thanks, Marissa. And hi, everybody. Welcome to today's webinar. Firstly, I'd like to thank you all for your attendance and your giving us your time today. I'd also like to thank OPHA for their support in our partnership in delivering this webinar, and our two speakers, Krista and Luis, who will be introducing themselves as we get started on the webinar with regard to Agile. Just before we get started, just a brief intro to Leading Edge Group and who we are. We are an international organization located here in Toronto, Canada, also in Ireland, and we have a business in Australia. And we really are focused on continuous quality improvement, particularly through enhanced operational excellence, quality improvement through lean, the agile methodologies, and digital optimization, and really right across the health sector. We work with a lot of public health organizations and are pleased to have partnered with OPHA for the past 9 years in delivering Lean Sigma training programs to the OPHA's members across the province and in fact beyond through yellow, white and green belt training and black belt over the last, as I say, over 9 years at this stage. We do work right across the health sector, well, obviously in public health, but also healthcare, community health and social services, family health teams, etc., right across the sector, but also in other areas of the public sector, for example, local government, and in cross-industry financial services, supply chain, manufacturing, really any industry we've supported, which really, I suppose, demonstrates how applicable lean, agile, and digital are right across all industries in terms of their focus on process improvement. Our services are based on training and consulting, across lean, digital, and agile, as I was saying, and we also have a technology solution to host continuous improvement and support it for organizations. So without further ado, I'm going to hand you over to Luis, and I would hope you enjoy the webinar and you find it insightful. As Marissa has outlined, there is an opportunity to ask questions, so I would encourage you to provide any questions through the Q&A function. I will be coordinating those at various stages through the webinar itself. So I look forward to any queries that you have and hope you enjoy the session.
Thank you, John. So let me just briefly present myself. I'm Luis Manuel Garcia, and well, my background is computer science, but it's already a bit ago that around 2005, when I was exposed in the company I was working at that time to something called Six Sigma and Lean, and later on to Agile. And one thing happened there, it changes my professional life and a little bit also my private life, by the way. So what has happened is that from that moment on, I actually left my, let's say, classical consulting, tech consulting career and moved over to continuous improvement methodologies based on lean, and Agile. So I had also the opportunity to work as a consultant, but also as a end customer responsible for implementing this way of doing things. So I know a little bit all the challenges you have as a consultant, but also the ones you're facing while you are trying to implement that thinking, that way of doing things. So saying this, my aim for today is to explain you and give you a little introduction on what Agile is about, a high-level introduction, the main principles of Agile, and talking about some myths about Agile. I see and I'm hearing Agile in the mouth of everybody. Agile is very trendy, but it's not always the case that I hear some the right things about Agile, and there are a lot of myths around about Agile, which I would like to hopefully boost and explain whether they are correct or not. I know that a lot of you know about Lean, that you have done Lean, and it's a recurrent discussion I have with people when I talk to them about Agile, what that means. And the question I got, okay, should we now stop doing Lean? Well, the last years we were doing Lean, should we do no differently with Agile? And I say, this is the wrong question. It's about, you will see that Agile and Lean actually are complementary and can be very well combined in the benefit of your continuous improvement efforts. And last but not least, I will end up with some examples, real examples in the health sector on how Agile could be applied. So what is Agile? The quick version is Agile is just the ability to move quickly and easily forward regarding the progress of the service you want to implement. So this is the short version. A little more complex version explaining it is that sentence I would like to read, because it sums very well what Agile is all about. Agile, or the Agile mindset, allows organization to respond and to changing market conditions and customer needs through incremental iterative work, and therefore reduces financial risk by validating the idea before investing in it heavily. Okay, let's stop a moment here. Let's get back to some of the ideas we have in this sentence. First, we respond to changing market conditions. So Agile fits very well to some specific environments, which I will explain in a moment. So when it is very dynamic, that's where Agile comes in, where you do not really know exactly what the final outcome of the final situation will be. That's where Agile can help you. It talks about the customer needs or the client needs. We are listening constantly to the client. We are validating what we are doing. The service we are improving and creating is constantly validated by the client. We are not waiting 6 months to put a service or a piece of service in production to see how it is working. We will involve clients as soon as possible to know that we are on the right track when we are doing things. And in consequence, we reduces the financial risk because, again, the ideas are validated before. So what was life before Agile? Typically, when we were asked to run a project, we started with collecting the requirements, creating a design, build a prototype, then we test that prototype, we fix the issues we found, and then we launch it 2 years later or 1 year later. This is the way we did it traditionally. And there are environments where this is still a very good approach to do things. For example, when we want to build a bridge, right? So we know exactly what we have to do. So let's do a project, and a waterfall approach of doing that project is the perfect fitting approach methodology. But our current situation or environment is no longer like building a bridge over the river. It's more like we want to build a car, but I do not exactly know what car I want. So we know that the client wants a car, but what kind of car? A car. So traditionally, we started building a car, and at the end, after a long period of time, we deliver a time, and hopefully it meets the customer expectations we were aiming to collect, let's say 1 year ago. Instead of this, in Agile, we want to deliver very fast value. What does it mean? In this example, graphically, we give you a skateboard. Of course, a skateboard is far, far away from a car, but we do that. This is already validated by the customer, and maybe we figure out something we didn't know before, that the client experiences something which was not expected, like the wind. He wants to get some fresh air and enjoy that very, very well. So at the end, we built a cabriolet instead of a car with a hardtop, because this is validated and will fit much better customer expectations. So you see the difference. First, we think we are able to collect. We need to collect everything the customer wants to have, go back to wherever we are, build the service or the product, and hope that we are meeting our interpretation of customer needs, instead of constantly means every 4 weeks, typically 2 to 4 weeks, we are validating a small piece of what we are finally aiming to do and to create by the client, so that we know that we are on the right track. I mentioned there are some myths. So it says, okay, to go there, Agile, I said you go fast, you will be quick to get to the end point. So Agile is a little bit, it's a synonym for anarchy. And I've seen these examples where just people forget about everything about documentation, planning, meetings, say because it's Agile, and it is not. Agile has a clear governance, and has a clear planning, it has planning meetings. It doesn't say no documentation, it says less documentation, just the one needed, but it's not forgetting about all the good documentation. And well, a typical example I hear very often is, Agile is nice, but it's only for IT. That's not true. It is true that Agile was created within IT, and this is where it started. But I can, by experience, tell you that it works perfectly. And I'm not talking about my project in which I was involved, of course, in tech, but also in finance. I'm mentioning in industry, and of course in the health sector. In some of the projects I was involved. So if I'm going back to using that kind of traditional waterfall approach, what we're doing in Agile, we are doing and delivering value in something we call sprints or increments. And what we do is very, let's say, simply spoken, we do all the phases we traditionally did in the waterfall approach within a sprint. What it means is we select what we will do, we build it, we test it, and we validate it, and we go live. All this is done within a sprint, an iteration. Okay, so to let you see that we have a very clearly defined structure in Agile, what it means is, of course, we have to know at the very beginning whether we have to we go north or south. But then we go to our clients and listen what they want to have regarding that vision, these overall objective. We create by something we call user stories, which is nothing else than taking into account customer expectations in their language. With that, we create a product backlog, which is nothing else than a list of items and features our service should have. And now comes in the sprint or the iteration. We take a subset of all these features in our product backlog and commit to implement that during the next 2 to 4 weeks. We commit to that. And we commit to that means we will, at the end of this sprint, we will deliver a piece of our new service to our clients to be validated. This is a value increment, which happens every 2 to 4 weeks. Every 2 to 4 weeks, we get customer feedback. And in opposite to our traditional approach in Agile, we embrace changes. We like and we love changes. So if we do a sprint, we go at the end of the sprint, we validate something, and the client says that, or it's not meeting what the client was expecting. That's nice. That's okay. That's fine. We were able to fix that just after 2 to 4 weeks, and not at the end of an overall project. So in Agile, we embrace, it's a completely change of mindset. We embrace changes. Of course, Agile is not working, sorry, Agile is not the solution, the response for everything. So where should we use and should go for Agile? By the way, I've seen also, I have some colleagues or people which are implementing Agile, then they started and saying, oh, from next month on, we're doing all the projects we have now in an Agile way. This is also not the correct approach. So which projects are, or which environments are fitting well for Agile? They are so-called the VUCA, environments where you have, which are VUCA. What is VUCA? VUCA is an acronym for volatility, uncertainty, complexity, and ambiguity. And we have a lot of examples. Isn't our life like that over the last years? Just some examples, the Brexit, new competitors coming up and thinking about Tesla or Uber. And just recently, we are even not out of that, COVID-19. It changes completely. We are not able to build services or products aiming or thinking that things will remain the same over the next even 6 months. So that's where Agile comes in, and this is giving a very, very good answer and approach to deal with that uncertainty and complexity. Why? Because we are, as I said, we are embracing change in Agile. Every 2 to 4 weeks, we're able to adapt our initial goals and our initial planning to whatever has changed in the 2 to 4 weeks. The only period where something is fixed is during this 2 to 4 weeks. During that time, we commit, and that's the thing which will not change, because we have to be also effective, of course. But at the end of these 2 to 4 weeks, we will double check if we're still on the right track, if this is still what we need, what the client needs. Okay, so in Agile, we have 4 principles on which the whole methodology is based on. Agile says, and this is called the Agile Manifesto, Agile says that we put individuals and intention over processes and tools. We are really people-focused in Agile. We're looking for a collaboration. We need collaboration to progress. We are looking more for a full working service or product over comprehensive documentation. Our aim is to get something working at the end of our 2 to 4 weeks of our sprint. We have to have something working over comprehensive documentation. We are looking for customer collaboration over contract negotiation. Agile responds to a fact that not everything can be specified in a contract. Every situation can be specified at the beginning over a life cycle of a project. That's wishful thinking. That's the reality. So that's why we are aiming for very constructive customer collaboration by engaging the client from the very beginning into our Agile projects. And the last one, as I said, we are responding. We love to respond to change instead of following a rigid plan, because our environment is not working like that. So how do we or aiming to stay on a fixed plan is just not reflecting reality. Okay, so when I explain that to people, they say, okay, that's nice to see. Looks okay. So as I mentioned, what about Agile? I was doing Agile, and the one of you, and I know that a lot of you who know Agile, you see here some of the most common tools in, Agile Lean, some of the most common tools in, typical tools in Lean. should I start doing it now in an agile way and forget about what I was doing in lean? And as I said, this is not the right question. The right question, how can they combine? And agile is really looking on creating something fast, a minimum viable service which can be put, which can go live, and which the customer can experience. Why lean is actually looking, so agile is looking on effectiveness, while lean is looking on efficiency. Agile is looking to get something done fast, maybe not the best, in the most efficient way. And that's where lean comes in and helps to polish that part of the increment, that value increase, by getting all the inefficiency out of our newly created agile process. So they combine very, very well. And on top, let me tell you that both you will recognize immediately. If you are a lean expert, you will immediately recognize that they really pursuing have the same objectives. Like they are looking for continuous flowing results. They're really looking for quality improvement and continuous improvement. The emphasis on the flexibility instead of authority-based control, collaboration, empowerment, self-control teams. And this is only working and can work when you have the right respect for people, both the same, whether it's agile and lean. So good news here, agile mindset and methodology is a set of attitudes that support an agile working environment. And if you have lean experience, you will see that you can use a lot of this experience and can just brought over to agile, because it's just working in the basis is very, very similar. There's a different methodological approach to doing the things, but the basics on how you deal and involve people is basically the same or very, very similar. And the good news also on methodological approach is that you can learn it. So the agile is a methodology. It's a thinking, but it's also a methodology, and therefore has some very good and clearly identified steps. So to respond again to the answer, whether it's lean or agile, you can, it's more lean and agile, and to combine them in the best way. Agile focusing on delivering results fast, lean on getting efficiency. Last but not least, examples. The first one is on the Phyllis Gen Center for Primary Care. Here, the challenge was to improve the patient experience for the annual wellness visits for patients. What they did, they prototyped, they painted basically using sticky notes, workflows of this visit process, and they engaged and did some prototyping. And prototyping means they did some role plays. They brought in some clients, some patients, and role played the changes they did. And very frequently means after each sprint, to validate the changes they were doing. It powers the team. They were able to make their own decisions, not waiting for any hierarchy decisions based upon the feedback they got from the clients. And another example, but by the way, these are examples of the private sector, but could be translated easily to public health. We have here very, very much closer the Jewish General Hospital, the program, the Hospital at Home, which is about delivering care at home, putting patients at home to increase the care, the number of beds, available beds, etc., and to follow up, because it's a fact that people recover, patients recover better in their own homes. So what they did is just, and by the way, that program started before COVID-19, and then COVID-19 came in, and of course then everything changed the rules and had really to respond fast to that new situation. What they did is just create a virtual ward in which they designed the process of attending and caring people at home. There was a big challenge around the technological literacy of the patients and also the clinicians, because it was you have to use some video conferencing technologies, IoT, but doing it that way was responding to imagine, well, there was no previous experience. COVID-19 was changing the rules every week, every day. And that way was really, Agile was really helping out in defining or creating, and what they call the Jewish General Hospital called the minimum viable product, which is defined as the patient could be safely transferred home and receive care as fast as possible and constantly, and this service could then constantly improved. So these are the two small examples I would like to give you and to share with you. And before moving over, it's now moment for a couple of questions if there are.
Thanks, Luis. Excellent presentation. Just one question before we hand over to Krista, just in terms of like the vast majority of people on the webinar, I'm sure, are quite new to Agile in terms of having put it into practice. From your point of view, briefly, what would be the key first steps to take? Like, where would an organization start? How would they start? What would be the key kind of steps to get off on the right foot? Because obviously, lots of organizations are doing quality improvement, are doing lean. Agile is something new to a lot of organizations. Where would they start? Where should they start?
Okay, I would say, well, learn Agile first. So don't think that Agile is just as an adjective and say we'll do things simply faster. Get a good understanding what Agile means. I just gave you a very high level overview, but it's a very structured approach. Learn it. And then take a very simple example, and just the one I can refer exactly to the Jewish General Hospital example. Why they did, they were trained on, the people who performed the project were trained on Agile. They did a training, and then they were they got a help and support by an experienced person. It was me, by the way. So helping them to run the first initiatives. Do not just solve world hunger problems. Just take a small one that actually this was pretty challenging, by the way, but it was still something manageable in terms of scope. And start with that. And the good things about Agile is also it has implicitly built in the methodology something we call retrospective. So it self-improve constantly. Start. It doesn't really. It's not that important that you will do everything correctly, but because we have built in the methodology some moments of reflection to understand what was working well and what can be improved, you are sure that you are constantly also improving what you're doing on Agile.
Perfect, thank you. Some more questions coming in. I'll deal with one more just before we hand over to Krista, who is going to take us through the specific opportunities and application of the methodology in public health. And I know we've one question in particular relating to public health and specifically, which we will deal with. Krista may well deal with it through her portion of the presentation, or we'll certainly address that question at the end. Just one final question for yourself, Louise. With regard to, are there templates and tools used for Agile over and above those, say, that you would have for Lean? Obviously, Lean has a lot of tools and templates attached to the various techniques associated with Lean. Are anything specific when it comes to Agile, or is it very much just the idea of sprint, feedback, sprint? So
is it sprint? Say the last sentence.
Like, is it just primarily a sprint with feedback and a sprint with feedback, or are there actually specific tools and templates what we have with Lean?
There are tools. I'll give you an example. When we have to when we run to sprint, I spend a lot of time talking about sprints, but when we do a crucial moment at this to be successful in sprint is to do a right estimation at the beginning of the sprint. What will be covered, what do we commit in doing the sprint? And there are specific tools for this estimation we do at the beginning. We call this the sprint planning event. And there are tools to do the right estimation. Of course, there are a lot of tools we do specifically, or we use specifically in Agile. I just gave you the overall framework. Perfect, thank you.
We will deal with further questions and we're tracking them as they come in. So just in the interest of time, I'd like to hand it over to Krista, but we will deal with, as I say, the additional questions at the end of the webinar. We were leaving some time at the end for questions. So with that in mind, I will hand you over to Krista, who is our lean and public health expert, who's going to talk us through the opportunities and the application of Agile in the public health environment, which I know many of our viewers and attendants today are part of the sector. So Krista, I'll hand it over to you, and I'll come in at the end again for final questions.
Thank you. Hello, my name is Krista Gallick, and I am pleased to be here today as one of the presenters for the webinar. I am a Lean Six Sigma Black Belt, a trainer and consultant with the Leading Edge Group, a registered nurse with a master's in public health, an educator, and a certified instructor and facilitator. I have over 15 years experience working in public health, and most recently supported the COVID-19 vaccination rollout as both a quality manager and a logistics manager. Big thank you to Luis for the introduction to Agile and how Agile can be applied to any organization that creates the processes, mindset, and culture to engage and collaborate with clients, whereby enabling it to respond quickly to customer, client, and community needs while controlling costs and quality. The next few slides demonstrate how public health is an excellent candidate to adopt Agile methodology into practice and our projects as we connect and engage with our clients so well already, but now have the opportunity to purposefully use Agile to meaningfully engage and collaborate with our clients, stakeholders, partners, and communities more frequently and methodologically. This is an additional tool in our toolbox to take community engagement to the next level and incorporate and prioritize Agile. When we have a defined project, we can use Agile to engage with stakeholders at scheduled times and have the client provide feedback through all phases of the project lifecycle. And as Luis discussed already, through the project and when it's live, have real-time feedback and real-time adaptations to the project or the service. For example, the Health Equity Program Requirement number 3 in the Ontario Public Health Standards requires boards of health to engage with relevant stakeholders to decrease health inequities. This engagement and collaboration is required as per public health standards, and Agile can support this work even further to frequently meet at all phases of the service development, right from the brainstorming and conceptualization to and throughout implementation. This allows the end user to inform each iteration with recommendations across the project lifecycle. For example, as Luis mentioned, meeting with the clients every 2 to 4 weeks and making frequent changes to the project or service requested by the client, ensuring that the end service is driven by client need and demand. An example of how to operationalize this in public health practice could be to add to all committee or advisory committee terms of reference that a member of the committee must have lived or living experience with the topic. This will ensure that when a project is in the development phase or in the implementation phase, the advisory committee can be used as a forum to have the voice of the client available to directly impact, co-design, co-create, and inform the service, product development, and/or program. Having this forum readily available is a quick win for the chair to use an Agile approach as a method to schedule sprints with the committee every 2 to 4 weeks to inform and validate the progress of the deliverable or service. The next slide demonstrates the quality and transparency requirement 8B from the Ontario Public Health Standards. Within this standard, we are required to measure client, community partner, and stakeholder experience to inform transparency and accountability. Once the value creation, which is also known as the sprint deliverable, is launched and operational, an Agile approach can be used to evaluate the project. Even if Agile was not used in the development phase, you can still use Agile methodology in the monitoring and evaluation phases. Agile can be used to purposefully meet with clients in sprints to drive the monitoring and sustainability of the product. As frequent validations from the client are received, this feedback is used to continually reassess, reevaluate, and tailor the program and service to redefine the product or service features to meet the needs of the client. There is also an opportunity to have varying levels of Agile adaptations in practice, which may be used in the monitoring phases. In the event of not having a formal evaluation, there remains opportunity for an Agile approach to be used for monitoring of the project. I invite you to take a few minutes to reflect on how you currently engage with clients to seek their feedback on your services. It is critical to the project and the monitoring phase of the project to continually re-engage with clients and continue to tailor and adapt our programs and services to meet the client's needs and ensure the deliverable continues to be valuable to the end user. And Agile can be a tool to support this work. Let's take this reflection activity one step further. Take a few moments to reflect on how you currently engage with clients from the conceptualization phase right to garnering continuous feedback in the evaluation phases. With what you have learned with Agile methodology thus far, how can you use Agile in practice and purposefully engage with clients more frequently to get their feedback at each iteration of the development and implementation phases and to drive continuous quality improvements in the monitoring and evaluation phases of the program? So just take a few seconds to think about that and think about how you can purposefully use Agile in practice to garner continuous quality improvement feedback from the clients. The next slide focuses on the policy framework for public health programs and services, which outlines 4 key principles that ensure that boards of health assess, plan, deliver, manage, and evaluate public health programs and services to meet local needs while also working towards common goals. I will share an example of how Agile methodology can be used as a tool or approach as public health partners, collaborates and engages with partners, communities, and/or clients. Agile methodology can be a tool that guides the engagement plan and supports how and when public health can continually and purposefully seek feedback on the planning and delivery of our work. Agile encourages innovation and accelerates a culture where everyone is working together towards a common goal. Agile involves the end user and requests valuable feedback throughout the project lifecycle. This results in the client informing the rollout and implementation, and that the end user will receive the program or service in a way that is most valuable and meaningful to them, which results in the program being responsive to the needs of the community. The Center for Disease Control and Prevention's principles of community engagement provide a spectrum of increasing level of community involvement with key pillars of impact, trust, and communication flow. Agile methodology outcomes are most evident in the collaboration and shared leadership part of the spectrum. The Agile methodology provides a tool to ensure that the final decision-making of the end service is informed by the client and at the community level. By engaging with clients and community and seeking their input through bi-directional flow of communication, we are creating strong partnerships based on trust and transparency. An example of shared leadership in public health practice and how Agile methodology was used is evidenced throughout the COVID-19 response. Partnerships were formed with communities, and public health actively sought continuous feedback from the stakeholders, communities, and clients, which informed the development and implementation of the COVID-19 vaccination rollout. Many partnerships were built and now have formed strong partnership structures built on trust that now have a channel for bi-directional communication flow that can be capitalized on for future work. Luis spoke briefly about the difference between lean and agile. Agile methodology is a style of project management that focuses on early delivery of value through continuous improvement of the project that results in the delivery of well-tested products that reflect client needs. By incorporating lean methodology and agile, we can find efficiencies, decrease waste, and add value, and respond flexibly to change with quick tested recommendations happening very early on throughout the building phases. Adopting both lean and agile in public health will produce valuable, streamlined, meaningful programs and services that are tailored and informed by the client and end user. Communities will feel ownership of the deliverable and will maximize uptake and trust from the end user. By using both agile and lean methodologies, continuous quality improvement is evidenced in action. A few examples of CQI in action include the goals of the product, program, and or service is in alignment with the client's vision. Each iteration of the product involves quick tested and informed process changes. Using lean methodology ensures that waste and non-value add activities are detected early and are eliminated. Low priority or non-value added activities that are identified by the client do not transform into the final product. The client has a direct forum for identifying and recommending improvements throughout the program development lifecycle and implementation. And the client has the opportunity to reprioritize service development based on their needs and the community needs. The next few slides, I'm going to take you through an example of how public health can use Agile in practice. In this example, we will use Healthy Growth and Development Requirement 2A3 from the Ontario Public Health Standards. In this requirement, a public health nurse or public health worker is developing a program of public health interventions using a comprehensive health promotion approach. The project is that the public health nurse is creating a new clinic model and a new way to deliver the nurse, parent, and baby wellness clinics. Before investing too many resources into the project and the clinic, the public health nurse would like to validate the program idea, clinic plan, and vision with key stakeholders, and together develop the program and clinic model. And as part of the project management and program planning, the public health nurse adopts Agile methodology. With this, the public health nurse establishes a working group and identifies key stakeholders and clients and defines roles and responsibilities of the group. Next, a work plan is developed that outlines a schedule with timelines, frequency of meetings, stakeholder tasks, and the process for decision-making. With the Agile approach, the stakeholders are a part of the project from the very beginning and have opportunity to provide feedback to the clinic model and the program in real time. The public health nurse meets with the stakeholders every 2 to 4 weeks to showcase each iteration of the program plan and presents the clinic model. The public health nurse presents the stakeholders with small but consumable increments of the program and clinic model, and the stakeholders provide feedback on each iteration directly to the public health nurse. Between each meeting, the public health nurse refines the program plan and clinic model, and based on feedback received, makes immediate adaptations to the project or the service. And at the meetings, the public health nurse encourages innovation and new ideas and encourages the stakeholders to reprioritize project goals and plans based on their needs. After multiple reviews and iterations and adaptations to the program and clinic model, and as Luis previously discussed, this program and clinic model is live and has real-time changes to program and clinic models based on the client and stakeholder feedback. The final product is developed and is directly informed by those involved in the delivery of the program or the parent who will be accessing the clinic or service. At each phase of the project lifecycle, there was shared decision-making that led to the success and quality of the final product. Agile facilitated the changes by bringing a team together, empowering them to do rapid testing and review of the proposed clinic models, and the public health nurse welcomed changes based on the feedback received. That concludes the presentation component of the webinar. I will pass the presenter role back to John to facilitate the questions that were received from the Q&A.
Thanks, Krista. Appreciate that. We have some questions and we have some time to address, I think, most of them. A few questions coming in on funding, Krista, in public health, and particularly that it can be a barrier to community engagement. And obviously, it's an important and very involved undertaking that that needs to be involved to do well in a comprehensive way. And the question around, where can health units expect to get funding, resources, and staffing to undertake such a process? And that's come up a few times with regard to the barrier that could present. That obviously, while engagement, can come across as we need to engage with clients, we need to engage with our health community. Obviously, it's quite comprehensive. There's a lot involved, and funding can be a barrier. So, any insight you can provide on overcoming that?
Mm-hmm. I can't speak directly to where to access funding for incentives for clients. However, thinking innovatively and creatively on how we can make the focus groups or the involvement directly to the project valuable to the client, and how they see themselves as being a valuable member of the team and possibly being a volunteer, and the impact that would have on them to support the decision making and be part of a bigger project. If there is funding available for small incentives, that would be something to look into at a local level, but definitely tailoring the approach to community involvement and the need and the impact the community members can make on the final product and what that means for the community and public health.
Yeah, particularly I think it relates to the health inequities regarding adequate representation for subpopulations that would be, I suppose, experiencing any inequities and may not have the capacity or resources. So I'm assuming your viewpoint really is that there's an opportunity here for right across the community to have an impact on, I suppose, better delivery of service and better development of policy, etc., and that can obviously be to everyone's benefit.
Mm-hmm.
Perfect. Question coming in from Louise, that the approach is very similar to developmental evaluation. Would you be able to speak to the differences or similarities?
To which one, sorry?
This is for Krista, actually, I think, because it's from Louise. It said the approach is very similar to developmental evaluation. Can you speak to the differences, Krista?
I actually don't have much information right now on developmental evaluation. Is there another term for developmental evaluation from Louise?
Louise, maybe you can provide that in the text. And in the meantime, a question for you, Louise, which comes with regard to what helps or hinders an organization that is adopting Agile. The person posing the question asked that it could be difficult to get staff on board. Do IT people generally like this approach versus traditional? So I suppose it's really around what are the factors for success, what are the challenges in getting people on board?
Well, it's pretty straightforward, the answer. It's inertia and mindset. It's not about the complexity of the tools at all. It's just that we are proposing to work in a completely different way and encourage people to work completely different, collaborative in comparison to what they were doing in the last 5, 10, 15 years. So this inertia is not always easy to overcome. And the mindset of you're breaking completely the concept of authority, the hierarchy. Of course, hierarchy will be there always, but it's not a command and control approach anymore. We are talking about self-organized teams, which might make you take the example of a sprint. During the sprint, the team responsible to deliver the increment will take their own decision without any other input. They have the authority to do whatever they do and change to meet the milestone and to deliver what has been committed at the beginning. This change of mindset is and I said, together with inertia, is always something which is recurrent as an obstacle.
Okay, and I suppose somewhat related to that, and maybe Luis, you can take this one as well, about the where change is involved in the initiative. And I assume by that we mean change management and facilitating the change. You know, are there particular stages of the project where that would be sort of to the fore, or is it something that would maybe obviously you need to be conscious of throughout?
The change in
change and change management.
It refers directly to my previous comment that because it requires to change the mindset, and this is one of the biggest challenges. I say, well, I don't think I need more than 15-30 minutes to explain most of the agile tools. It's more around bringing people to work in this new way. When I ask people that you have to commit, you have to get clients' feedback. The one item I mentioned a couple of times, embracing change. This is completely different. Embracing change is usually what you do not want to see. When you have a project, I don't want to have change. I want to stay to my plan and deliver. And in Agile, we say it's just the opposite. Let change happening, because change is coming from your clients, and it is coming in because they are validating and reviewing whatever you are producing. So we are embracing it. And this you have to manage with change. In the bringing people to that point, you have to, of course, apply and use change management skills to change their mindsets.
Absolutely. And then both of you again, maybe Luis, we start with yourself, and Krista, you can feel free to hop in on this one as well. How do you recommend that representatives chosen to participate in the feedback process are able to provide feedback that is representative of the client as a whole, rather than providing feedback that might be very specific to their own individual needs?
I have some, I'm sorry, I have some problems with your understanding.
So really, I suppose the representatives chosen to participate in feedback, in getting feedback.
Yes.
How can we be sure and be able to recommend that we want that feedback to be representative of the client as a whole, as opposed to maybe specific individual needs that may be suitable for one element, but not the overall?
Yeah, it's also a good question. So how do you assure that you got the right feedback? So, well, this is not an Agile specific problem. It's like, well, how do you get a good representation of your client? And yeah, you have to decide, and it is project depending whether you will do, whether this feedback will happen on face-to-face conversations, whether you have some interviews, where you do some qualified testing group, maybe you have some representatives, maybe you do some surveys. It's dependent, and that there's no single answer on that. And you have to, but it goes beyond Agile. It's basically always the kind, how do I get a valid representation of a specific group, in this case, the client. So, but it goes, depending on the context you go for one or the other.
And I think on that, Lean actually, and the whole Lean process around stakeholder identification, we have what we call a SIPOC tool, which identifies all elements of a process to actually map out and identify who are the key stakeholders that we need to receive feedback from, so that you are getting that all-encompassing viewpoint, as opposed to narrowing down into a particular area. So that I think that's where Lean and Agile combine so well in terms of that overall stakeholder mapping that one would do at the outset of any initiative.
And that's a good point, by the way, John, because the stakeholder management is something you do as in Lean and in Agile the same way. Just to be aware who actually is your stakeholders. It looks like an easy question, but it's not always the case that you know exactly who's your stakeholder. Who are your stakeholders?
Absolutely.
And you do that in both, in Lean and in Agile.
And actually, Louise has added to this in the comments, outlining that panels are set up in the community with a variety of different people with different demographics who agree to be surveyed on a variety of different topics.
Exactly.
So building on that again, what tools would we use to prioritize suggestions from stakeholders, or any particular tools? Obviously we get lots of suggestions, from which is what we want. We welcome feedback. That prioritization mechanism, I assume, I'm not the expert, but again, we go back maybe to the quality improvement and how we define what is critical to quality, what is critical to service excellence, and that being a way of guiding how we would prioritize suggestions.
Yeah, there are a couple of tools you can use to prioritize these items. And I'm just thinking a very high level filter, and you to say, okay, you'll be put into comparison the value you get out of a suggestion and the complexity it has to implement this suggestion. So we put them and put this together with the timelines we have. This is a way of prioritizing. There are specific tools in Agile which are used to prioritize what we call backlog items or sprint items. It would go a little bit beyond. So there are tools which are, but beyond the ones you maybe are using already in Lean, in terms where you can use them exactly the same way. Sorry, the same way in Agile, by the way.
Excellent. Just going back to developmental evaluation, Krista, on that one, Louise came back, and the fact that it takes place during the program or service planning and includes quick verification with clients to ensure that the planning is on the right track as the design goes forward, which allows evaluation to result in reflecting the actual goals of the program and obviously not poor planning or design, and especially useful for innovation.
Well, that sounds fabulous. I'm going to look into that further. And Louise, if you want to discuss that more thoroughly offline, happy to have a quick call with you to learn more and to see how developmental evaluation and Agile are similar and the work that they can complement each other.
Perfect, thank you. And just final couple of comments, going back to the inequities and the funding. Obviously, people addressing in the community who volunteer their time are, I suppose, obviously living in low income and may not have the capacity to volunteer, and it's obviously valuable to have them volunteer as part of their CV, but there obviously are real world barriers that can hinder participation, and it is challenging, of course, to expect people with lived experience living with low income to volunteer their expertise for free, while obviously service providers are being paid for their efforts. I would have thought, Krista, a continuing challenge within public health in any case.
And to possibly bring your consultation and your service to them where they are, so that there is no transportation barriers, and try to alleviate those barriers where you can. Possible to get funding for lunch and food or bus tickets. I'm not an expert in where to get the funding, but to look at a local level to see what's available to you and what options are available to try and alleviate those barriers and go to where they are in a rural community. And if you and your team are driving out the 45 to 60 minutes to be in their area, and to alleviate that barrier if it's transportation or food or income. I know there are bus ticket chits, and lunch is a nice incentive as well, but not sure where the funding would come for making that happen.
Appreciate that, thank you. I think that covers all the questions and the comments. I would say we are right up at 1 o'clock now, so we'd like to thank everyone once again for all of their participation, for first and foremost their attendance. Secondly, the actual questions and the comments have been very, very great participation, lots of comments, lots of questions. So really appreciate you putting some thought into that and giving us your time in that regard. I would like to thank our two speakers, Krista and Luis. Really appreciate your time and your expertise and your input. Obviously, like to thank OPHA and my Leading Edge colleagues for helping organize the webinar. I'm going to hand it back to Marissa to close today. Final reminder for anyone who may be new to both Lean and Agile, we are offering Lean Sigma training programs in conjunction with OPHA coming up later this month. And so Marissa will provide you with further information on that, or certainly you can go to the OPHA website if you're new to the whole world of Lean, not allowing Agile. We are offering those later this month. So with that, I will thank you once again. Really appreciate your time and your participation, and I'll hand you over to Marissa.
Yeah, thank you. So again, I just want to reiterate, thank you, John, thank you, Krista, and thank you, Luis, for joining us from Leading Edge. And as John said, we do have those upcoming trainings. So if you do want to register, if you have any questions, please visit the OPHA website and we'll be happy to connect with you further. If you want to connect with the Leading Edge group or OPHA on our socials, they are also seen here. And I just wanted to alert everyone on the line that there is going to be an evaluation sent out to your inbox. There is just 2 questions, and would really appreciate you to fill it out. So with that, I'm going to sign off and hope everyone has a great afternoon.
Bye.
Thank you. Bye.
Thank you.